Mr. Travis Beaman. Great to have you on the show. Thank you for joining the podcast, Brain, Hope, and Reality. I feel like you and I, haven't known each other that long, but we certainly had an interesting time together so far.
Oh, yeah, absolutely.
Yeah.
Dr. Lipov, I appreciate you having me on the show.
It's an honor to have you. Thank you so much. And I'm so happy we're able to stay in touch. And by the way, I love your pen.
No, thanks.
That is a beautiful pen.
Yeah,
So part
absolutely.
of the thing, what do you think of my graphics? It's PTSI, not PTSD.
I mean, it's fitting. But I mean, there's a lot more that goes into what that's saying that I think has to be described and understood.
Exactly. So what I want to do is kind of briefly for the audience, I have my own spiel up front, but maybe you can just quickly tell the background, how we met, and then we'll do the show.
Yeah, so we met back in 2021 at Fort Bragg, or at least we were connected through some people that were doing some work at Fort Bragg.
Right.
And Jeff Dardia had mentioned my name, and someone was like, "Hey, we're going to do this new trial to help out with guys that have PTSD, and let's go up to the Stella Center and meet yourself." And that's how we kind of got introduced way back in April, May of 2021. But I didn't really meet you until July of 21 in Chicago.
Right. Yeah, and just if you could just run a quick background, you were in Special Forces, so I thought maybe we can just people, everything about you. I know something about you, but I thought very brief background. And I love the term you're starting to use. I wonder where you picked it up. Wounded healer. I think that's an amazing term.
So a little background. I grew up in Chicago, just on the northern side, up in Glenview, in a kind of a poor place. And during that time, my stepfather sexually molested me. But I would go on to join the Army in 2000. And I would end up having 5 combat deployments to Afghanistan and a deployment to Africa. And through all that time, it's having this, this trauma sense of feeling of this doom sense on me that I never knew when something bad was going to happen. And as I described, like being in Afghanistan was like going downtown Chicago. It was always this stress on me that something was not right or something was going to happen to me. And then, so over time with introduction of alcohol, added stresses of moral injury of war, getting more educated, and having all these things happen, like I start to really doubt like the purpose of living, and that I would be a functioning father and husband, and that I would have any self-worth or be able to provide the best way possible because of all of this incidences as I was growing up. And then I met you, and it kind of, and I went to a lot of, psychotherapy and going to inpatient rehab and working a lot of social work and trying to figure out how to manage stress of life. And all of those things try to make, day-to-day living manageable.
Right.
And it worked. There's those things helped. Psychiatric medication and antidepressants, they helped for a while. But it always came back to all of those events and those traumatic things that I had gone through always seemed to come back over time. I couldn't get them away out of what was like up in my face every single day. And so then, I went to the Stella Center, and it kind of really took a lot of load off me, at least with the DSR, and a lot of sense of living came from the ketamine infusions. But this recent thing recently got brought to my attention was this wounded healer concept of there needs to be people that have gone through really hard things and have gone through like the progression of suffering and the journey, then the healing part to be able to have the open arms to the people who are going through that journey portion of their trauma, to say, to have someone to be related to, and that's someone that understands how they feel inside at that moment of that journey that they're going through. And then I think it also helps that the person who's going through that journey, that there's hope at the end, because sometimes during those years of working, you tend to think that it will never end, and that pain will never ever there won't be any end, and there is no hope in it to, why should I even work any harder, as I've been doing this for years and years, and the pain of every single day is just too much. And so to have that person that gives people that hope to keep trying for another day is really kind of, means a lot. And it seems very like resident inside me.
So, it's interesting. So even though I've never been in the military, but I think the whole concept of wounded healer means a lot to me, because I assume I shared with you, I was hit by a propeller blade. I almost died. When my mother killed herself about a year later. And I was pretty wounded. And, my father had severe PTSD from World War II. Out of his squadron of 10,000, 100 made it home. So he gave PTSD or PTSI, hopefully the term trying to change. And then this living with persistent doom and gloom for years and years. And the big question is always, as you said, hope. That's why I put the name Hope in the podcast, because if there's no hope, why even bother? Why? I mean, it's like, I've done 40 years of being a pain physician, and a lot of times people lose hope. They go, I have this horrible pain. Could be emotional, could be physical, could be a combination of both. And it's like, it's going to be like that forever. So my answer to them is, that's why seeing someone to be treating you, you can fix the pain. You can fix the emotional pain. You can fix, or at least you keep trying, because once you give up, then the suicide rate goes up. All of that goes up, right? So I think I love the term, and I think you're certainly become much more empathic. As a clinician, it's very important to be empathic. But as a speaker and a leader, I would say you're much more empathic because you've actually been there. And then I think from people who hear it, it normalizes. Horrible things happen to all type of people, all type of strata. It doesn't matter wealth. It makes no difference. But I think what you've done with it, right? It's no fun to go like I was there for your TED talk in Portland. Kind enough to give me a challenge coin. Thank you very much. But you're standing in front of 500,000 people or whatever, and you're telling a very rough story, and you really had them going. I mean, it's like they were like crying. There's all type of things going on. But the point is, people, to me, if you see that, you hear that story, you go, my life is hard, but his life was a lot harder. But yet he stood there. And he stands there right now, and he's actually done something good with it. And you're doing something positive. Like people ask me, it's like, how do you? Your job must be an interesting job to do what you do. And is it stressful? I said, it's like actually my job is probably the best in the world for me, because every time I help somebody, I feel like my mother's looking down and say, hey, you've done something good in my name and in her stead. So I think it's an amazing concept, and the other part of this whole thing about resilience. Everybody talks about resilience. I'm writing a chapter on it, but I'd like to throw some learning from what I've learned out of it recently. So whenever I do anything, I always research things. So I cut down the resilience to 4 letters. Here, HERE: humor, exercise, respect, exploration. Turns out that humor you and I have talked about, I think the PTSD is controlled by amygdala, which is part of the brain that controls PTSD or PTSI. Turns out humor has direct impact on the amygdala. It can relax or deactivate the amygdala based on neuroscans, which I think is like mind blowing, at least to me. I had no idea. Exercise produces endorphins, makes you feel better, gets you out. Yeah, it's pretty clear. I think self respect is huge. I think if don't let anybody tell you you're useless, and don't let basically respect yourself, right? And
Yeah, but
exploration, you want to see what's available. I think that's a very simple way of looking at resilience. What do you think?
yeah. So the last one is just curiosity of the brain.
Right. Yeah.
That's fine. And the second one you said
Exercise.
was exercise. So that's dopamine. So does it all boil down to
Endorphin.
of our opiate receptors in our brain?
Right.
Is that
Well, no,
it
it's
boils
part-
down, but like that up and down. That is, are we putting? What are we putting in there for our brain to utilize? Because because if you're desensitized, how is that helping? Right. So
No.
if
What do you mean by
so
that?
like
I'm confused.
so then what are you doing for pain? So there's things that you can do on your own
Right.
for pain relief. Like, so you're doing exercise. So that during exercise, the pain of your life isn't felt as much, is because you're getting endorphins from the exercise. Right. And then the humor is making those same dopamine release, right? The serotonin and all that stuff into your brain. So those opiate receptors are getting something, right? And the same thing. So what's the third thing you said? And I had a thought on that.
So humor, exercise, respect for yourself and others.
Yeah. So then it's like, how do you view yourself? And so if you talk down to yourself, then, and you feel like you're of zero value, you provide nothing for others, then why should I live? I mean, that's simple. I mean, that seems
I
to
agree.
absolutely correlate there. So if you can't one, make fun of yourself, if you can't take exercise upon yourself, if you're not sleeping properly,
Yep.
all of those things are causing issues. It's not necessarily just one of them.
No, of course not.
I like it. I think it's
It's just simple prescriptions. I'd like to. Do you think my mother had a great saying? She said, "Never say anything about yourself. Somebody will do it for you." Is that cute?
yeah. I mean, unless you're wrong, just like horrible people and this that don't have any empathy or care on you, then it's just like toxic, and it's just gonna drain you completely, which is not. I mean, and that's when people need to say, "Hey, these are my boundaries, and I'm gonna go back to taking care of self and leave you out of my life."
No, absolutely. So let's switch gears, if you don't mind, to PTSI. So we're very aggressively trying to change the name PTSD to PTSI, post-traumatic stress injury. So I've had some occasional, not very common, but occasional pushback saying that no, there's no need to the name change, and it doesn't make any difference what the term is used, PTSD, PTSI. What do you think of that?
Well, defining it absolutely makes a difference, for sure. Because if you ask with someone on the street, define disorder, and what does that mean to you? And if you say define injury, and what does that mean to you? So if you look at disorder, to me, that is something that you're innately born with, right? Like it's just the DNA of who you are, and there's nothing that can be changed about it. But the injury thing is that it can be mended, it can be healed, and that you can change that whatever has happened to you. So if the brain is injured, like Phineas Gage, right? He had a stake go through his head, and his behavior changed. He just didn't watch something happen and his behavior changed. There was actual physical damage to his brain, and then the way he acted after that was because of that injury. So then to say, like, if we look at like a Bears defensive lineman, right, and he hits impact and there's something happens to his brain and he's injured in the CTE concussion, right, and his behavior changes at home. His behavior is changing when he drinks alcohol. His behavior is changing him because he had a direct something happen to him. So that's like how I just separate it, is that this disorder is innately our makeup as a human being and not something the environment caused me and not something that an experience or an injury to my body caused me. It's two separate things. And so that's why I see this disorder piece on attached to it, like to stress, is not makes any sense, because stress, good or bad, is based off of either something happening directly to my body or the environment that I'm in. That's why to me it's different.
Right. So one of the things that I wanted to kind of say, Phineas Cage is a fascinating story. I just want to give you some background on that. Mm-hmm. It's amazing that you know it. Just shows how much knowledge you actually have. So this guy was lying down railroad and he exploded. He put dynamite in and he put 1-inch pole in dynamite, exploded, went through his eye, went other side. The part I find about that story is fascinating was he went to Mass General, a big hospital in the States, still is amazing. And they looked him over and they go, oh, nothing happened. You had no injury. Everything is fine. You can walk, you can talk, you have normal reflexes. But he had other little problems later. He became animalistic. Anytime he saw a woman, he would take his clothes off, chase her around, and so on. So that I would say that's not so much. But what's interesting about PTSD or PTSI, if you look at the brain scans of people who have it, no head injury, no TBI, nothing, you can actually shrink the brain by about 10-15% from glutamate secretion. So the point is, you don't need a physical injury to the brain. You can actually see something horrible, and it changes the brain. And that's why we call it PTSI, post-traumatic stress injury. Now, TBI, traumatic brain injury, and PTSI, unfortunately, occurs way too often.
So now you got both of those things that happen.
Right.
So now we're talking about like complex PTSI, because now you have an emotional impact, and then you also have a physical impact. So now you gotta go after both of those things. Which is, it's doing one is hard enough, but now have to work on both is extremely difficult.
Exactly. But it's doable. You're an example of that. I mean, that's the point is, and you know, the thing that you minimize it sometimes, but the amount of work you've done after stuff we've done with you is significant, because you will get back what you put in, right? If you expect everything to be done for you, which is really not the Green Beret style per se, but you know, you're putting in effort, and it gets easier and easier. Do you find that to be easier and easier as time goes by?
So I think learning the tools and learning how to manage my life and how a real person walks through life was the first thing that I had to realize, that everybody has stress in their life. And the way that I handle stress is different, because I wasn't taught those coping mechanisms as a kid. I wasn't taught that, like, this is what feeling down feels like, what feeling up feels like. Having, you know, mood normal ups and downs is just normal. My problem is that we're so extreme that when I was low, it was lower than most. And then when I was high, it was higher than most people. So there's that aspect. And then what do I do with all the stress? What can I do that's not drugs or alcohol to take me away, disassociate, not to deal, but to cover up the stress that I was having, and not really finding a good outlet of either, like, recognizing how much that exercise really helps, how much like spirituality can impact the way that I see myself in the world. Being a volunteer to someone, sharing my story and about how I communicate that story impacts other people, and how much that took off of what was inside of me because I was able to share it, and how to like take that prison down by writing a diary or writing, just a journal. Doing all of those little things are things that have helped. And then go into like different modalities of, cognitive behavioral therapy, the EMDR stuff, sitting down in a social worker, sitting down in like an AA meeting or NA meeting, and seeing how that and those steps and those things that they're doing you can use every day to make you feel better. And then sleeping well and having a good diet. So there's all these, the circle is vast, and it takes time to become an expert, or at least have
Efficient.
better knowledge in it than what you did at one part in your life. So you go through all of these steps to try and figure out life. Unfortunately for me, like I'm getting pulled out and deploying in between some of these times. And then, I had the curse of believing that alcohol was going to help me in a lot of the problems. And I was drinking so that I wouldn't remember the past. But at the same time, when I'm drinking, I'm starting to hate myself. So that's not working out. And so, I go to rehab and I learn a vast amount of skills, and I spent 2 or 3 years like implementing these things and seeing how each one of those things that can help me, and understanding that what I'm hearing from my wife isn't exactly what she's saying, and being able to have a conversation about this is what I heard from you. Is that what you were trying to say? And opening up those communication and that push and pull with the people around me, because I would just hear something and I would internalize it, and it would just eat me within. And then I finally got to you, and then it changed. It's like I want to say the cherry on top, but it allowed all of the skills that I had used in the past to finally put them together, and is phenomenal. And so like the two, ketamine and the DSR, right, was the key to unlock all the skills that I had built, essentially.
Perfect. So I want to give you another term, which I've been looking at longevity since I'm getting to be old.
Mm-hmm.
So there is a new term called hermesis. I don't know if you've heard that term.
No.
Hermesis is basically a study of what doesn't kill you makes you stronger. So the way they figured it out, they were giving fungicides to fungi. If you give a little bit, those fungi become much stronger. If you give too much, it kills. So I think you and I both are example of hermesis. Turns out it changes the DNA. Isn't that amazing? That's why I asked the question. I think what's cool about it, you can actually repair the DNA, make yourself stronger, and there's biological markers now you can actually measure hermesis. Is that nuts?
I would wonder if like how you would take like different people in their life and be able to measure it as like kids, and do a study on like we have 100 kids and they all just go out into life, and we meet them at different stages at 20, right, 40, 60, 80, and whoever, and to see that like document what the things that they've been through, and to see how those things are traced within their body.
But the point that I learned out of that is, how everybody, like I think most people, including me, try to stay away from trauma, stress, whatever. So what I've heard people say before is like, oh, I learned this from trauma. I was like, or post-trauma growth. It's like, thank you very much for that. Turns out there is actual science behind it.
Yeah.
Who knew?
Yeah, so I mean, that's like saying that like you have to live hard in your 20s and 30s to be a wise man in your 40s.
Depends how hard,
right?
Depends
so
how wise.
it's like wisdom, right? You got to put yourself through tough experiences to gain wisdom on your own, and then it's self-reflection and being able to come up with an idea and being able then to express it in a manner that is digestible to other humans. So
Right.
how much time are you spending on doing that as well? It's like you might have done all these things in your life, but if you never tell anybody about it, is it any good?
It depends. I think it's highly individual. Depends what people. But I think what you're doing with everything you've done so far and everything I think you're planning, which is I applaud you highly for that, is that you can change people's lives, right? If you can save one life or 10 lives, that's why I have the best job in the world, because actually I can see people's changes, and you're opening people's lives to saying, hey, I've been through all this craziness, but your craziness may not be as bad, who knows? But look where I'm at now.
Right.
You're happy and you have a happy family, which is, I think that's all we should be aspiring for, as far as I'm concerned.
Oh, that's absolutely right. So that, I mean, it's the defining of this PTSI is why I think the drive is so incredible, because I think the impact is almost unmeasurable by changing it.
It's going to be
Because
global. It's going to have a global impact.
because if it so what's the impact of a word getting put into the dictionary? Right? It changes
Depends on the word.
our vernacular
Right.
forever. And if it changes the way that people talk, then it changes the way they receive it. Right? And so if that's the biggest thing, is this just, I am going to go get help with X thing, and it's just normal, right? I think that it takes that mysticism out of it, of just this. A disorder is something I can't explain. It's almost to say autism diagnosis. I don't know what's going on in the body. I have no idea, right? Autism disorder. I'm on the spectrum, but I don't know what's wrong with me. Have no idea. There's nothing that shows the direct correlation that this is in my brain or in my body that's causing this. Where this is different, right? This PTS is like, with the scans and the technology that we have of today, you can see the exact injury. And then as you start to do work, treatments and everything, you can see that injury get better. So there's a fix, a cure, rather than a management approach.
I call it lifestyle, right? So you don't want to have a mental health lifestyle. So I just want to throw another concept by you. So, in medicine, right, in most medical things, if something happens to a human being, same thing happens to animals, right? So you have an animal model. So if you have a broken leg, it looks a certain way on X-ray. If you have a broken whatever, anything else, you can identify. So if you break a leg of a dog, or if they have a broken leg, it looks the same. I mean, a little different bones, but same thing. So I was able to treat a PTSD dog using stellate ganglion block. So it turns out 1/4 of the dogs that return from Iraq, military dogs, have what they call VPTSD, veterinary PTSD. And the symptoms are sleep difficulty, personality change, aggression, or submission. The point is, if you can replicate it, it's not a disorder. It's real. It's no different than broken leg. That's been the whole argument I've been trying to say for a few years now.
So I would ask you then, is once the dog gets the treatment and they were put back into their pact, what happens?
Well, this particular dog, let me tell you his story. So I only treated one so far. We're trying to set up a time to do 6 more, actually. But this particular dog was being trained as a service dog. Somehow he got off the leash or whatever, got stuck on the truck and got burned. So horrible. And then before he was a sweet dog, all of that. After that, he was aggressive. He had difficulty. He was eating cages because he was so anxious. So after he was treated, his use of THC, they were giving him a lot of THC, was reduced. And a lot of his personality came back. So he was a pet. He wasn't like in wild dogs, but he was a pet. So the person who introduced me to him, her job is to train service dogs. So she makes service dogs. So she knows animals very well. So she was very in tune with them.
Yeah, so I would just be curious, like, is there data or was there data taken that before treatment, dog went into dog park with other dogs and acted a certain way, and then after treatment goes into the same dog park with the same amount of different dogs,
right?
And now their behavior has changed. Like that's significant.
Yeah, that's what the handler told me.
Yeah, it's phenomenal. So if it's happening there, it's just the problem with humans is that we do a really bad job reporting data,
right,
and reporting back to doctors so that it can show the effects. That's where we have problems. Is that guys like I feel better? I'm just going to go on my way, and I'm not going to respond to so that you have data points to show stuff.
Well, this dog was kept at somebody's home, but my point though is, I don't have like a PCL5 equivalent for dogs. I don't have anything that fancy, right? But basically, the good news is the owner was very happy with the result. Actually, I'll send you the video that I have a YouTube on that. It may be interesting for you to look at. Anyway, so I usually try to keep this to 30 minutes.
So I would tell you that my owner is very happy with the results.
You know, my owner is, I call her Commander in Chief.
Yeah.
I had my stellates done, and I was significantly improved by function across the board. Great. That's funny. That's
awesome.
Funny.
It was so funny.
Well, thank you,
Trevor. I appreciate
Trevor.
you having me on. Anytime.
Thank you. I appreciate the help. And
please reach out to me. And, let me know what I need to do, and
I'm going to take you up on it.
So we continue. I know.
Thank you. Thank you so much.
Okay.
Bye-bye.
All right, sir.
All the struggle and pain